Good evening, everyone. I am Richa Sehra, Editor-in-Chief, Responsible Hospitals, and today I welcome all of you on our Insta Live session. So today's session is all about breast cancer awareness because, as you all know, that we have been going through a phase wherein n number of people are, women are actually facing this challenge and facing this problem very commonly and very frequently. So we will be talking about the myths and facts about the breast cancer, and that is how we will be helping a lot of women to create awareness about it. So we would have our guest, one of the best surgeons in breast cancer category, and he's quite popular and educationist, and who is creating a number of people in India as a doctor. So we all look up to him, and may this session goes well, and I think this is going to help a number of people who is facing such problems. So I'm just going to add. So he'll be with us live within a minute, and we'll start our session sooner. Guys, in case you have any issues related to breast cancer or any doubts related to breast awareness, breast examination, types of cancers related to the breast, so you can just type in your questions in the chat box and I will be picking up your questions. Though many of you have already sent your questions. So hi, Dr. Rohan, can you hear me? Hello? Hi, Dr. Rohan. I can't hear you. I think there's a network issue, guys. So I think he will be able to log in again sooner. So just be with us. Dr. Rohan, can you hear me? If not, then probably I can't hear you, properly. There's little problem in the network, I think. Can you just try changing your place? Maybe that helps. If you can hear me, just type in yes. Probably I can. Guys, I'm going to add him once again because there was a little network issue. We will be starting a session soon. Guys, if you have any concerns, any doubts related to breast cancer, you may type it in the chat box. I have already received so many questions and I will be talking about that very soon with him. And I'm sure many of you who are a big fan of Dr. Rohan will be enjoying this session, and I feel that it's going to help to all of your students and Dr. Rohan and a lot of our viewers also. Yes, hi, Dr. Rohan. Can you hear me
Hi.
now?
Yes, I can. Can you hear me now?
Yes, better. So
Yeah.
first of all, I welcome to your Insta Live session because this is the topic which we wanted to, talk about since long time. I think
Mm-hmm.
this is the best time we can just start talking about it. So I
Absolutely.
welcome. I hope this goes well with a lot of viewers. This will be helpful for a lot of viewers of ours. Yeah.
Right.
So
Yes.
great. So Dr. Rohan Khandelwal is one of the best breast cancer surgeon, and he will be talking about the myths and facts about breast cancer. We have a lot of people who are hearing us today, expecting mothers and even new mothers and mothers with toddlers. I think this is going to be the great one. If you have any questions, you can, just put it in the chat box. We're gonna pick up some questions from here as well. So we will be starting right here. So, Dr. Rohan, since you know that breast cancer is something which is quite prone these days, and most of the women are getting this kind of cancer frequently, but they frankly do not know that how is it popping up, how is it become so frequent. What are the reasons behind it? So we will be talking about these questions certainly. Probably we can just start with what is breast cancer basically in your words.
So we all know that cancer is uncontrolled growth of cells. So when cells start growing uncontrollably, that leads to cancer, right? And if a similar thing happens in breast, that's called breast cancer. And as you rightly pointed, it's becoming a major issue in India. So the current statistics are that 1 in every 21 Indian ladies will develop breast cancer during their lifetime. Right. So if you have 21 Indian ladies gathered somewhere, at least one of them is going to develop breast cancer. And it is said that by 2025, India is going to reach the international statistics that is 1 in 8 women. So
Oh my God.
that's quite a high number, right? In
Yeah.
fact, just recently, just a month later, just a month back, the UK and American stats have now become 1 in 7. So this disease is really increasing very rapidly. And during the course of our discussion, we will discuss the causes why this incidence is increasing. But that is to answer your first question regarding what is breast cancer and what is the current incidence.
Sure. So, I would really want to know from your side that, because we will be talking more about the myths. Lot of simple questions like when do we start examine, that you are developing a breast cancer? What are those stages? And at what point of time a woman or a girl or a female or teenager should start checking out that she's prone to develop the breast cancer or she's getting some disease. So what is the right age? Maybe we can just start with it.
Sure. So good question. So in India, first of all, I would like to start that in India, breast cancer is occurring a decade earlier as compared to the Western world. Right. So if in US and UK it's peaking around 55, in India it's peaking in the early 40s. Right. Having said that, we have detected breast cancer in patients as young as 24, 25, and as old as 93. Okay.
Really?
So so there are three ways to detect breast cancer early. One is breast self-examination, when a lady examines her own breast monthly to see if there's a lump or not. Now, ideally, that should start after 20 years of age. The guidelines say 20 years of age every month, but it is the terminology has changed. Now we say be breast aware, means a lady should know what her breasts feel like and if there is any change or any lump developing. After 25 years of age till 35 years of age, once a year, the lady should visit a doctor for examination. Right? So between 20 to 35, once a year, lady should visit a doctor for examination. After 35, once a year. Every year, they should go to a doctor for examination. And after 40 years of age, a mammography should be done every year.
Okay. So, doctor, tell us about the ladies who are breastfeeding babies.
Mhm.
Do you think anything because of the feed, they also get engorgement or lumps? Does that also takes you towards the cancer stage in case they try just avoiding that or maybe ignoring that very frequently if it happens? Does that
No,
also
so
positive?
breast engorgement, breast abscesses don't increase the risk of breast cancer, right? So that is very clear. So if I just have to go over the risk factors for breast cancer, you can
Yeah.
have non-modifiable risk factors and modifiable risk factors. Non-modifiable risk factors are those which you cannot change, right? Which are the gift of God, you can say, or a gift from your parents, the genes which you've got from them. ठीक है, जो
Mhm.
विरासत में मिले उनको बदल नहीं सकते हम. So वो non-modifiable risk factors are increasing age. As the age increases, the risk increases. Okay.
Okay.
Then the other risk factors are early menarche. If a lady starts getting her periods early on, so it has been seen that last 20 years के अंदर जो average age of onset of periods है, that has come down from 14 or 15 years to 10 years, right? And one of the major cause for that is childhood obesity. So that is another risk factor. Then delayed menopause, if menopause is occurring late. Then ladies not having children, that also puts them at a higher risk. Having children later on in life, right? So if you ask your mother, वो उनने बोला होगा या उनके आप अपने grandmother से पूछेंगे, they would tell you that their first child was around 21, 22 or 23 years age. But
Absolutely.
nowadays the trend is that after 30, ladies have their first child.
Yes.
So that puts you at a higher risk of breast cancer. Also, because ladies have started working, they have reduced the amount of breastfeeding, the duration of breastfeeding. So it is said that if the duration of breastfeeding is 1 year, then it is protective. It slightly reduces your risk of breast cancer.
Okay.
But abhi, because ladies have started working, they have reduced the duration. So wo protective effect bhi chala gaya. So these are all the non-modifiable risk factors, which we can't change. The modifiable risk factors, three things which you should remember: obesity, smoking, alcohol. If you can cut down on these three things, or if you can maintain your weight, no smoking, no alcohol, you cut down your risk of breast cancer by 30 to 35%.
Okay.
Right? So these are some of the risk factors which one should be aware of. So breast abscess or breast engorgement does not lead to breast cancer.
Sure. So, doctors, you have, clearly mentioned about these things, and you have also mentioned one of the factor that, they plan the babies little later. So, are you trying to say that what is the right age for them to plan babies, according to you, looking at today's scenario?
No, so
Or,
I won't go into those suggestions that what is the best age to plan babies and what is the best age to get married. All I can recommend is that try that breastfeeding is done for at least 1 year. So appropriate amount of breastfeeding should be done, and one should be breast aware. One should go for regular screenings and do their preventive health checkups.
sure. So, I have got one question from Sushrit, Sushrit Chandra. Sir, is there any role of molecular classification of breast cancer in the management other than, I think he's talking about some
Yeah,
book
yeah. So
stuff.
that, yes. So
Your students.
yes, molecular classification does play a role when we are treating breast cancer, and there are various molecular subtypes of breast cancer. So the treatment does vary according to the molecular subtypes. Yes. So anyone who's been detected with breast cancer, we do these molecular subtypes.
Sure. And what are the types of breast cancers, doctor?
So breast cancer predominantly starts from the ducts, right? There are 15 to 20 ducts in the breast, and breast cancer starts from those ducts. So it is called ductal carcinoma because it is duct se arise kar raha hai. Now, as long as it is localized within the duct, it is called in situ or stage 0, where it is not spreading. But if it pierces the duct and it starts to spread, then it is called invasive ductal carcinoma. मतलब वो invade कर रहा है and it is spreading. So that is the most common type of breast cancer, invasive ductal carcinoma. Similarly, you can have lobular carcinoma, जो breast lobules हैं, उनसे भी cancer बन सकता है. So those are the types of breast cancer.
Sure. And I have got another question. I have a history of reoccurring fibroadenoma. Even after the removal, also it appeared again on separate location.
Yes.
What is the
So,
reason?
yes. So fibroadenoma is the most common cause of a breast lump, right? Breast lump का सबसे common कारण एक fibroadenoma है. Commonly, it occurs between 15 to 25, 30 years of age. And 10% fibroadenomas can be multiple, and there is a 10% risk of recurrence as well.
Doctor, if you can just talk about what is fibroadenoma. I think
So
layman may not.
fibroadenoma is a non-cancerous lump. It is a benign or a non-cancerous lump in the breast, and breast में गांठ बन जाती है. So it is very common. It is mobile, हिलता रहता है breast के अंदर.